Hi, teachers and classmates. My name is Shou Zhuang. Today I'm going to talk about health promotion plan for high school obesity. Based on the study of high school students, childhood obesity has been a big issue in the United States for years. Studies have shown that 13.9% of high school students are obese and 16.0% are overweight. Community health and obesity. The community health focuses on the maintenance, protection, and the improvements of the health status of population groups and communities. The underlying problems of communities' health and that contributes to obesity are low income status, like poverty and poor neighborhood, poor nutrition such as fast food industry, which has low protein and higher sugar, lack of recreational spaces, lack of parks and playgrounds, limited physical activities such as watch TV and overeating, poor healthcare access like lack of medical facilities such as hospitals and urgent care, no public transportation that may cause people to stay home being physically inactive. Learning needs assessment. A community includes a group of people, and people are composed of individual persons. So, learning needs assessment should be divided into community and individual. Community needs assessment includes leadership like a school principal, park, or recreation that will promote physical activity. Poor school meals and lack of PE classes might indirectly cause students obesity. A high crime rate causes people to stay home. Food insecurity means the decrease of access to affordable and nutritious food. Poor economy status means that people cannot afford to buy healthy food. Individual needs assessments including self-cultural practice, self-interest, self-behaviors, self-perspective for health, self-ability, emotion, and rules. Health promotion model is created to increase people's level of well-being. Panda's health promotion model on obesity focused on changing the students' behavior to healthier food, starting with breakfast. Studies have shown that a good breakfast has excellent effects on physical and psychosocial well-being. A good and healthy breakfast reduces the risk of becoming overweight, decreases the incidence of chronic degenerative diseases like type 2 diabetes or cardiovascular disease, and improves cognition and learning. Students who eat breakfast have better performance, fewer absences from school, and fewer behavioral problems. The teaching plan can focus on individual characteristics and experiences, or behavior-specific cognition and affect, or desirable health promotion behavior. Health promotion and health education plan. The goal is to creating a healthier community. 3 behavioral outcomes. We hope by the end, students are able to prepare the healthy lunch and snacks, develop a good habits of sleep early and wake up early, and the students are more alert, have better mood and better concentration. Researches and other evidences. The 3 articles here, the first one is discuss how to change students' behavior towards healthy eating by using social ecological model. This model explains behavior that prevents obesity and describes how nutrition education could be implemented from interpersonal, organizational, and community. The second article discusses the framework of the individual, family, teachers, and community. The teaching plan focuses on developing training program, creating more support system. The third one, this article uses the Panda health promotion model by investigating individual and community behavior and developing teaching plans based on behavior. The teaching plan may focus on changing behavior in students and developing regular schedule, such as sleep and having healthy meals. Evaluation. We use three-lens evaluation tool, includes social justice lens, cultural place lens, organizational capacity, organizing approach lens. So the social justice lens means all people should be treated equally and have equal access to food and resources. Cultural place is about a community's culture, which includes individuals' value, rituals, pattern of thinking, and group identity. Organizational capacity, organizing approach. Organizational capacity refer to human, physical, financial, and political. Organizing approach refer to community organizing strategies. The conclusion is the idea for the way forward. So I choose brain reward system because this system is to control your response to any pleasurable experiences by releasing dopamine. The pleasurable experiences like sports, exercise, sex, and of course food. And dopamine is the feel-good hormone. To modify the behavior, we can change patient's diet, give up junk food, and choose healthier and higher nutrient food. Or creating a meal plan like smaller meal and more frequency. Develop exercise plan, drink more water, join social events, or consult your physician. This is a slide for references. Thank you for listening.